Hi everyone, my name is Nursi. Welcome back to my channel, and today we'll be discussing the SBAR communication technique and how it can be applied to case study of a patient complaining with chest pain. This video is aimed at helping nurses to effectively communicate with their healthcare team and ensure patient safety. So let's get started. So what exactly is SBAR? SBAR stands for Situation, Background, Assessment, and Recommendation. It's a standardized communication method used by healthcare professionals to streamline the exchange of information about patients. So let's break it down in each component. And if you want to help me, click on the subscribe and like button of this video. Situation. The S stands for situation. This is where you briefly describe the current situation of a problem, be concise and provide relevant information. B for background. The B stands for background. Here, you provide the necessary context, such as a patient medical history, recent events, or treatment. The next is A, which stands for assessment. In this section, share your assessment of the patient's current condition and any changes you have observed. Finally, R stands for recommendation. Offer your suggestions for further action on treatment, and don't be afraid to express your concern. Now that you've covered the basics of SBAR, let's apply it to a case study with the patient presenting symptoms of a myocardial infarction. Imagine that you're a nurse in a surgical ward, and your patient, Mr. Smith, is covering a following knee replacement surgery. And is currently on day 3 following surgery. Mr. Smith is a 60-year-old male with a history of hypertension, type 2 diabetes, and high cholesterol. His medications include metoprolol, linezolpril, atorvastatin. Suddenly, he complains of severe chest pain, shortness of breath, and sweating. You quickly become concerned and undertake vital signs and ECG. Mr. Smith's vital signs are the following: blood pressure 160/100, respiratory rate of 20, heart rate over 110, and oxygen saturate of 88 on room air. His rate is chest pain 9 out of 10, which is central chest pain irradiated to the arm. His ECG shows ST segment elevation in lines 2, 3, and AVF. So the patient clearly doesn't look well. We need a medical review. So let's now use the SBAR tool to communicate our concerns effectively to our medical team. I find it really useful when I started my career to use these tools to optimize my level of communication. Because maybe I was new to a unit, a specific unit, or maybe I was just new to nursing and I didn't know how to optimize my level of communication. So I think if you're new or if you're a nursing student or if you just qualified, this is very, very useful for you. So just get an SBAR tool online and you can buy mine and just use it. So let me demonstrate to you how would I do a handover on the phone if I had this patient and I needed a doctor to come immediately to review. Hi doctor, how are you? Hi, my name is Nursi. I work in the 11B ward, in orthopedic ward, and I'm calling about Mr. Patient Smith. He's 62 years old, and I'm calling because I'm concerned that he's having a MI. He has central chest pain on the which is 9 out of 10, irradiated to his arm, and he has experienced shortness of breath and sweating. He has an early warning score or a new score of 4. This patient was admitted on the 27th of the 3rd, 2023, and with the surgery for knee replacement, which he had 3 days ago. He had past medical history of type 2 diabetes, hypertension, hypocholesterolemia, and the patient condition has changed 10 minutes ago. His blood pressures, his new 2 score is 4. He has a blood pressure of 160/110, heart rate of 110, respiratory rate of 20. Upper axial SATs are 88%, he's on room air, and the pain is 9 out of 10. So it's central chest pain and irradiated to the arm. And his urine output the last time it was 4 hours ago, but he passed urine normally, and his BM is 6. So if you live in the UK, you might use news tool, so you can report the new score. You might say something like this: patient scores 4, news 2, and he's recommended review by the team. But be aware that the tools does not work well, like this example, so always follow your assessment and the tool just use it as a supplement. Any other relevant information is being sweaty over the past 10 minutes. I think the problem is that he's having an MI, and I have increased the oxygen to 4 liters, and his currently saturations are 95%. I've done an ECG. It has an increased ST elevation on leads 2, 3, and ABS, so maybe perhaps inferior MI. But I'm not sure because I'm new to the unit, and I'm not really goodly seeing ECGs. And I've done some bloods already where I sent troponins, and unfortunately I don't have any further pain relief to prescribe that I can give to the patient. So I really need you to come and see this patient and assess him and review him. And please let me know if there is anything that you want me to activate the protocol. Is there anything you want me to do in the meantime before you come in? Okay, you want me to send some username. Okay, I'm gonna add the FBC full blood count, usernames, urine, and electrolytes, and I'll monitor the patient every 15 minutes. Okay, see you in a bit. Take care, bye-bye. And there you go. This is an example how you communicate effectively in a telephone call for a doctor. And as you go along, things will get easier and easier, and it doesn't have to be so concise. But sometimes you have to give a very detailed and thorough SBAR and communicate well, because the doctors don't know what happened to the patient. They might be covering 3, 4, 10 words, and they might not necessarily know the patient. So in summary, SBAR is an invaluable communication tool for nurses and other healthcare professionals. It can help you to streamline the exchange of critical patient information and improve patient outcome. Remember to practice using the SBAR method to improve your communication skills and contribute to a safer healthcare environment. And if you want my SBAR tool, you can buy it on Etsy. Thank you for watching this video on SBAR and communication and our case study involving a heart attack patient. So if you found this video helpful, please don't forget to like, share, and subscribe. I also have a newsletter, so check it out on the main page, and where I share more nursing tips and educational. As always, leave your questions or comments below, and we'll see you on the next video. Stay curious and keep learning.